Morning, ladies and gentlemen. Today I'm going to describe my working position. I am also a family doctor and a general practitioner, and I provide these services from my clinic here on Rapta Road. What exactly do I do? My office hours are from 9 to 5, from Monday to Wednesday, and during these hours, I focus on health maintenance and also try to find out what is it that my patients have problems with, and I try to give them advice accordingly. Many of them have got very bad lifestyles and they do not know how to eat properly or sleep properly. Um, what I do in my clinic is I have an examination room whereby I examine the patient. Initially, I take a brief history, find out what exactly is the presenting complaint, how long have they been sick, and from there I try to make a tentative diagnosis. And after that, I give them if I have the drugs, I have some drugs with me, very simple drugs for simple conditions, which give them immediate relief. Um, I do not discriminate. All kinds of patients, old men, young women, old men, young men, women, children, and my job responsibility is diagnosing and treating a wide range of medical issues. Among these issues are upper respiratory tract infections like pneumonia and bronchitis, um, stomach infections, um, diarrhea and dysentery, urethral infections like urethritis and vaginitis. Um, I see a lot of infectious diseases like malaria and typhoid and viral diseases. And worm infestation is also one of them. I do see some cases of acute back and low pain. If it is a very severe patient, I advise them to see a specialist. If it is a very serious condition, or if it is a condition like diabetes mellitus or hypertension, then after giving them the initial diagnosis medicines, I then refer them to a specialist in these particular fields. Occasionally, I do work overnight and for extended hours if the practice requires. And I also do a bit of immunization for children. Uh, by performing primary care for the patients, I give them the necessary treatment. And finally, I refer the patients to specialists or diagnosis centers if I feel they need to be tested for the therapies, because there are some patients who need to be followed regularly, and it's not a one-time visit. They have to come back to me, and I have to be seen by the consultant, and considerably they have to be monitored regularly. I work during weekends, even at night. Sometimes I get called by patients at night, and then I do what I can within the circumstances. I think that will be enough for today. I don't want to bore you with my field. I am a doctor and a psychologist, so I try to balance the two. When I'm a doctor, I try not to be a psychologist, although at the same time I'm always analyzing my patient, and it helps me in a uh, total review of my patient. I've got a website, rajeshwari.com, in which I've mentioned the conditions that I have treated and which I've treated. And if you need to come and see me, you can come and see me at my clinic on Rapta Road, or you can call me on my telephone number 0789 or you just make an appointment by talking by writing a comment on my website, and you can get the directions to see me. I hope I have given you necessary information. If you have further details, if you require some further detail, please do not hesitate to get in touch with me personally. I'm available 24 hours and 7 days a week. any time of the day or night. If you call me, I will I will attend to you accordingly. Thank you very much, ladies and gentlemen. If you have any problems, do get in touch and have a good time. We live in interesting times. We just have to do what we can and hope for the best. Thank you, ladies and gentlemen. Bye.